You know, most of us never think about our heartbeat. We just don't, it doesn't cross our minds. But for both of you, that's not the case. Every month, about 10,000 Americans with heart failure or an arrhythmia, which is an irregular heart rate, have a device implanted to continuously monitor their heart rhythm and deliver a life-saving shock if needed. These devices, as you know, are powered by batteries that typically need to be replaced every few years and come at a price that's not always covered by insurance. So, Emily Herman, as you know, you live with this every day. And I'm pleased to have you joining us along with Dr. Ken Stein, who's the Chief Medical Officer of Rhythm Management at Boston Scientific, to talk about innovative technology that's helping patients avoid multiple replacement procedures and save costs. Emily, how were you diagnosed, and what was it like to learn that you need a heart device for the rest of your life?
So I began experiencing symptoms of shortness of breath, trouble breathing, and then dizziness when I would do physical activity or play sports, starting back as early as my teenage years. I eventually went to see a doctor, and they ran some tests and diagnosed me with a condition called hypertrophic cardiomyopathy. So for me, that means that it puts me at high risk for sudden cardiac arrest. And so shortly after that first diagnosis, they went in and they implanted a pacemaker defibrillator in me at age 19.
Okay. And how long did the pacemaker last?
I've had 3 devices over the past 14 years. My first 2 devices each lasted just between 2 and 5 years, which was really concerning when I thought about not only the physical effects of having to go through the device replacement surgeries, but also the financial effects of being on a high deductible insurance plan and really having to financially prepare for these inevitable device replacements. So my current Boston Scientific device I've had now for 7 years, and it's still expected to last another 5.
Oh, that's wonderful. So, Dr. Stein, how do these batteries work, and how has the technology changed over the recent years?
Sure. Let me explain a little bit about the defibrillator. At Boston Scientific, we actually developed the world's first commercially available implantable defibrillator. That's why we're sponsoring this interview today. And what the defibrillator does, it's an electronic device, gets implanted under the skin, and then gets hooked in through a wire or a lead that goes into a blood vessel and then into the heart. And it monitors every single heartbeat. And if the patient goes into a cardiac arrest, it can give a shock to the heart, bring the rhythm back to normal. I mean, it's just like, on the medical shows on TV where they come rushing and put the paddles on someone's chest. Because of that, it also functions for patients like Emily as a pacemaker. But because it has that shocking function, it takes a lot more energy than a plain old simple pacemaker. And because of that, typically these devices in the past have lasted a lot shorter lifespan than a simple pacemaker. And that's why folks like Emily in the past have had to have multiple replacement surgeries as the batteries have run down in their devices.
Okay, and I gather from the one that she has now from Boston Scientific, it lasts longer?
Yes, we developed a proprietary battery technology that we call EnduraLife. And there are now 9 independent studies that show the superior longevity of those devices. In fact, lasting up to twice as long as older devices or as some of the competitive devices that are still on the market today. And that's important. It's important for the healthcare system. It's important for patients because when the batteries run down on these devices, it's not like a simple consumer electronic thing like a TV remote where you just flip open a panel and pop in a new battery. These devices are hermetically sealed. And so when the battery runs down, you need to have a surgical procedure and you need to replace the entire device. And that can be expensive for patients and for the system, but it also, every time a patient has to have surgery, there's risk and there's discomfort involved.
I see. Okay. So it's put under the skin? That's
right. It's implanted under the skin in the chest.
I see. All right. And Emily, you told me this is your third device that you have at the present time?
Yes.
Okay. And you mentioned the cost. How does the cost work, and what do you do in terms of health insurance?
From the patient perspective, I guess I don't know what the going rate now is if I were to have a procedure now because it's been 7 years. But it's with my high deductible health plan, our out-of-pocket max each year is just under $10,000. So one of those procedures will likely cover a full max. So I'm having to kind of basically prepare financially to have a $10,000 chunk of money thrown in whenever the battery does start to diminish.
And the costs are important from the individual patient perspective. They're also really important from the overall healthcare system perspective. By extending the longevity of these devices and extending the time in between surgeries, we can save a lot of money for patients and for the system. In England, where they have national health insurance, they've got probably the world's leading health economics organization. It's called NICE. It's their National Institute for Health and Care Effectiveness. And they recently issued a recommendation that docs in England should preferentially use devices with these batteries. And they estimated that if they did that, they would save the government of England £6 million over 5 years.
I see. So it does make a big difference, the cost.
Yeah.
And where can people learn more about the use of these devices?
For folks who want to learn more about this battery technology and about the studies I've just spoken about, there's a website, devicelongevity.com. Certainly anyone who's got individual questions about their own health care, the best thing to do is go to your own doc.
Okay, so devicelongevity.com?
That's right.
And also from an individual doctor. I assume you would be going to a cardiologist. Is that correct?
Yes, that's correct.
Okay. Well, I want to thank both of you for sharing this information with me and with our Health Power audience. And I want to wish you both well. Emily, it was very good learning about you. And Dr. Stein, we certainly appreciate the work you're doing.
Thank you so much for your time.
Yeah, thank you. Appreciate you having us on.
Okay. Have a good day.
You too.